I'm George Alleyne. I'm originally from Barbados, but I'm the Director Emeritus of the Pan American Health Organization. I think the policies need updating because of the emergence of new data. We now have much better data on the magnitude of the problem. We have much better data on the means of preventing the problem and the means of treating some of the problems when they occur. That is why the current discussion on secondary prevention is so important, because we now have data to show that with the investment in secondary prevention, we can reduce significantly the mortality and morbidity from cardiovascular disease. And this new knowledge should be translated into new policy at the country level. The major problem lies in the level of the services, in the competence of the services, availability of the services. That is one of the major problems. And we can break down the issue of services into various components. There's one, the actual money, the money available to do certain things. And what would you use that for? To provide medications that are so essential for secondary prevention, because we believe that secondary prevention lies really on two basic pillars. One, the reduction of tobacco use, and secondly, the provision of adequate medication for persons who have had a cardiovascular episode before. So the availability is one factor, is one of the barriers. The human resources represent one of the barriers. In many of the low and middle income countries, as you know, there has been a migration of persons out of the system. So one of the things will be to actually provide the human resources necessary. And another one is that there has been a lack of resources at the higher level, and we have not been able to incorporate other professionals into what has to be done for secondary prevention. Over dependence on physicians, when we know now that what we describe as sharing, as load sharing, now it has become an important component of addressing these persons with heart disease. Basically, not only persons with heart disease, but secondary prevention for persons who've had significant cardiovascular episodes. Terribly important, but that is really very simple to say, terribly important. Let us look what we mean by the whole of society. I classify the whole of society as basically three buckets. There is the government, there is the private sector, and there is civil society. Let's start at the bottom, civil society. It is absolutely crucial to involve civil society in this. Why? Because civil society has the capacity to advocate for the availability of the medications and the treatments that I mentioned before. Civil society is perhaps the only organ that has the capacity to try to hold governments accountable for what they promise. Civil society probably is the only part of the society that can say to persons who have made these promises, you have made these promises. Why are you not fulfilling them? You should fulfill them. And also, civil society plays an important role sometimes in providing some of the secondary prevention of which we spoke. So as a part of society, whole of society, civil society has a terribly important role to play. The second one is the private sector. The private sector's normal occupation, normal province is to provide inputs, to provide goods and services. And one of the roles of civil society is to make some of these interventions more easily accessible and more easily affordable. One of the problems we have sometimes with the availability of some of the necessary interventions is the problem of access. Medications are available, but not accessible to the persons who need them. Private sector has a major role in assisting in the improvement in terms of access of what is necessary for secondary prevention of cardiovascular disease. And then government. Essentially, public policy is only set by governments. So government has a responsibility of establishing the public policy under which the various other parts of society can assist. in secondary prevention. And essentially, government has three tools at its disposal: legislation, taxation, and regulation. And we think that efficient use of these tools is absolutely critical if there's going to be effective public policy for the measures necessary for secondary prevention of cardiovascular disease.